Dr. Fonzik, I have seen a couple of times. I came in before to do a rhinoplasty consult with him, and really felt good talking to him. It's almost like talking to your best friend. Great bedside manners. It's very comfortable to talk to. The whole office, all the staff, they're really great and easy to talk to. I did some consults with other doctors in the area, and I saw their skill. And not saying they were very skilled, but you have to have that bond with the physician, especially, and I would think in plastic, something that's it's going to be seen, you know, and to make sure that you're on the same page. And I didn't feel that with other doctors in the area. So that's why I chose Dr. Fonzik. Well, I had a lot of questions. I had concerns. You know, I had done some research on the internet, as we all do, before we go get any procedure done. I had rhinoplasty done before, and he has just helped fix the bump. It was a really big bump on the side.
Tell me your story.
Okay, well, the first rhinoplasty I had done ended up with a hump, I guess, on the inside of kind of near my eye. And it was almost impossible to cover it with makeup. And I would not walk out the door, even if the mail, without it covered, because it was horrible. I mean, probably to somebody else, they didn't see it as much as I did, but to me, it stuck out there. Went to a couple of doctors in Richmond, because that's where I'm from. My family is from there. We're just here for now. And both doctors said they wouldn't touch it. They didn't think that anything could be done, unless you went in and broke the nose and did an osteotomy, which is, I guess, I guess it's pretty intense to do that. And Dr. Fonzik said, "No, we can fix this. We're going to do an osteotomy, but you know, so what? It's a little bit of work, but we're going to do it, and we're going to get it done, and it's going to look the way you want it to look." And it does. I'm pleased. I'm only 3 months out, so I still have some swelling, especially being a revision. So there's going to be even more swelling, but overall, he exceeded my expectations. I can't remember that day. I think I was so nervous. It went smooth as far as I can remember. I had a girlfriend bring me in, and she dropped me off. She actually waited, and he took me back to the surgical suite you guys have, and the anesthesiologist, I can't remember his name. He was great too. But he was back there, and he started the IVs, and last I remember was Dr. Fonzik kind of like rubbing my hair back off my face, asking me where I want to go on vacation. And then I was gone. I woke up, and I did have a terrible headache, I guess from the osteotomy, right here between my eyes. But as far as the recovery, it wasn't bad at all. I think the worst part is keeping that cast on your nose, because you want to just see what's underneath of it and see what it looks like, you know, and it's just underneath. So, like I said, he's got great bedside manners. Being a nurse, I'm particular about doctors and how they interact. He's just like I said, talking to a friend or a neighbor or somebody that you know. Well, very comfortable, easy to talk to. Dr. Fonzik is wonderful. He's awesome, and he's easy to talk to, and he's a great doctor. And if I had any doctor to choose, I went and saw many surgeons, plastic surgeons in the area, and he would be the one I would go to, hands down. I'm out of the state, and if I ever call with concerns, they call me right back and are able to comfort me, or you know, or say maybe you should come in, and when can you get in? I can't say enough good things about him, really, honestly. I was scared to death going, and again, through this, because you never know what you're going to come out with, you know? And really, when I started, the first one I just wanted to have a straighter nose, and it ended up being straighter on one side, and they're not concaved, but I guess it would be concave, wouldn't it, on the right side? So coming to see Dr. Fonzik was scary, because for a year, you can't really do anything for a year, so I had to wait a year until I could do anything about it, and having to trust somebody again. And I saw him 3 or 4 times before I agreed to let him do it. And it has nothing to do with him. It was just me going through it again and making sure, because I thought I could trust the first surgeon. Well, with being a nurse, bonding with your doctor is important. You want to have that relationship to where you know you can call him no matter what after hours if you're having problems. With Dr. Funzik, you get that. I mean, it's a lot of doctors, you feel like you would bother them or, you know, interrupt their family time or whatever they're doing. With Dr. Funzik, it's not that way. He wants you to call him, and he makes it well known. I mean, he wants to know how you're doing.